As I say, I can no longer just dress people on the outside, but it's dressing them on the inside. You know, and it's all well and good, you know, to do all these beautiful clothes that I do, and I love them. But in most hospitals, certainly not this one, you know, you're diseased, but where's the whole person being cared for? I really believe that the nurses and the doctors and the patients and loved ones need to be cared for, not only the disease. The Urban Zen program basically takes care of pain, anxiety, insomnia, nausea, and constipation. We call it panic. And the modalities that are used are in-bed yoga, Reiki, aromatherapy, nutrition, and palliative care.
You know, that tells me that UCLA is treating the whole patient, and I think that's what I've appreciated. The longer I'm here, the more I appreciate that.
And we felt that this was the missing element. So together, Rodney and Colleen got together and created a program where we train in-bed yoga, Reiki, aromatherapy with Young Living Oils, palliative care with Joan Halifax, and nutritional work. Holistically, we look at the body, so it's not just yoga. If people think yoga is kind of putting your legs around your head, you know, yoga is being present in your mind and body. Through meditation and yoga and all the practices, it really puts the patient, the loved one, the doctor and the nurse at ease.
To make a distinction that this is not just yoga therapy. We found about 3 years ago in implementing yoga therapy with Reiki, with nutrition, with aromatherapy, and with contemplative care, that is a magic combination that exponentially begins to bring us back to balance.
And there's no more compelling unit than a hematologic malignancy bone marrow transplant unit, because our patients with cancer of the bone marrow, they spend weeks in the hospital. So they have psychological and physical trauma from being there and from what we put them through. And so they are most amenable, as is the staff, to alternative interventions, non-medical interventions that might heal them emotionally as well as physically.
Yeah, the symptoms we were dealing with upstairs were mainly anxiety and insomnia.
Yes.
So we would use a lavender oil. We would put them in a position that makes you exhale easily, because when you're anxious, you don't really exhale. It's like a, right, this is your state of being. So when we put them in a yoga pose, a restorative pose that lets them exhale easily, everybody fell asleep that we were working on. It was so beautiful.
No one person could do that. This is not about me. You know, this is the time for we to get together. And it's a call out to the hospitals, to the doctors, to the nurses, to the people at large. You know, it's a collaboration of everybody coming together to create the change that we desperately need. Thank God that this hospital has allowed, you know, will be, when everybody says, oh, you're doing it at UCLA, oh, can I have it now? You know, I hate to say this, like, you know, you're wearing something, oh, where'd you get that? I want it. So, I can't thank this man enough to really being the arc of change, because he really does know what care is all about. You know, and that care is going to start at an educational level, at a patient level, at a loved one level, and it would really change the healthcare system. Most people said that I was nuts for doing this, but I am.